The way you get health insurance could be changing.
Yes, next month, some states and the federal government will roll out new marketplaces.
They are spots to shop for coverage, and mainly for those who don't get insurance through their jobs.
Now, they're also a key part of the Affordable Care Act. Our Kevin Schwaller is with us tonight, and he tells us knowing more about these markets can really help your health and the health of your finances.
Well, plenty of people simply don't understand the marketplaces. You probably have questions. Knowing the answers could save you thousands. Natalia Castillo is watching the time.
Telling my mom now I need to grow up faster.
When Castillo turns 19 in February, she'll have to deal with a major change.
I don't know. I don't know what's going to happen, but my insurance is going to come off, I guess.
And she understands the value of her Medicaid insurance more than most. She's driving a car her dad helped her get after getting into a wreck.
Yeah, my right knee, right here, the dashboard hit it.
That meant a trip to the ER and a prescription.
Pain medicines.
Her Medicaid covered the cost, something she could not have done on her own. Now she's hoping a new marketplace will offer an alternative. So in 2 weeks, Foundation Communities is going to be helping people fill out these applications for the insurance marketplaces. Of course, they'll normally be online. And on October 1st, this should be more than empty chairs. It plans to use 70 volunteers at 2 locations for the effort.
I mean, this is really life-changing for someone who has been excluded from insurance and can now obtain health insurance.
Elizabeth Colvin with Foundation Communities says confusion about the markets remains. And she can't say for sure how much these plans will cost until the marketplace opens.
But for some, it could be that they have zero premium costs. We don't know. And that their co-pays and their deductibles will all be greatly reduced.
For me, health insurance, it's like be covered, be secure that when you go to the doctor, you're going to be covered.
Castillo hopes a plan will give her peace of mind. Kevin Schwaller, KXAN News.
Now, remember, if you live in Texas, you must get a plan through the federal marketplace. This state opted out. Kevin mentioned that some people can get a break on premiums through the marketplace. So here's who can qualify for the subsidies. In general, a single person can make between $11,490 and $45,960. This is according to healthcare.gov. A family of 4 can bring in more than $94,000 and get help through the marketplaces. However, if your employer offers affordable insurance, you are not eligible for these lower costs.